Hello, 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 hello. I'm Dr. Hall. I am a nephrologist. Been practicing for about 20 years, and we're going to talk about proteinuria today. How do nurse practitioners, physician assistants, primary care doctors manage proteinuria? What should you do? Well, the first thing we want to do is define proteinuria. What is it? It's defined as a urine protein greater than 250 milligrams per day. Normal protein in the urine, normal amounts, is considered less than 150, and there's a gray area between 150 and 250, which we nephrologists don't know what to do about. We don't know what to do about that. But if you see that patient has a proteinuria level greater than 150, think, okay, this patient is spilling a little more protein than normal. I need to kind of start to intervene in some capacity. How do we calculate proteinuria? We calculate proteinuria two ways. One way, we can do a 24-hour urine, which is basically collecting a 24-hour sample of urine, and then we just analyze how much protein they have in that urine sample. The second way, which is the typical way that we nephrologists do it, we will check a urine protein to urine creatinine ratio. That ratio will give us in grams how much protein the patient's spilling in a 24-hour period. That's the gold standard that we use, or the easy, quick way. The gold standard is a 24-hour urine, but the easy, quick way is to use that urine protein ratio. So, what do we look at when we look at serum protein versus urine protein? The total serum protein on your comprehensive metabolic panel includes the albumin plus the globulin. So both of those proteins make up the total protein in your serum. Albumin is the most concentrated protein in the body. It's like a carrier protein. Globulin is more like an immunoglobulin, and it basically carries enzymes and complement and immunoglobulins. But those two proteins together equal 6 to 8 grams per deciliter on your comprehensive metabolic panel or your liver panel. So if you see that number too high or too low, that should cue you in. That's your call to action to look at, why is this person's total protein low or high. Also, the serum albumin, if your serum albumin is low, that tells you the patient is either not making enough albumin or they're losing albumin in the urine. Ding, ding, ding. Proteinuria. So if you see a low albumin, you need to think probably this patient has proteinuria, which could be nephrotic syndrome or some other type of protein wasting syndrome. How do we calculate proteinuria? Well, normally what we do, we take a spot urine protein divided by a spot urine creatinine. That gives us the amount of protein the patient's spilling in a 24-hour period. This is routine for us nephrologists. We do it all the time. And the urinalysis is great, but the urinalysis does not tell us exactly what we need to know. For instance, a patient who I saw about a year ago, she came in, she had 782 milligrams of protein on a spot sample, 290 milligrams of creatinine on a spot urine sample. We divided that 782 by 290, and we got 2.7 grams. So that ratio gives you the amount of protein in grams, not milligrams. So this patient had 2,700 milligrams of protein per day in the urine. So what do? We biopsied that patient. That patient had severe diabetic glomerulosclerosis, diabetic nephropathy, and we sent that evaluation and workup back to the primary doctor. We referred that patient to the endocrinologist so we can try to get their diabetes under control, so that we can try to prevent patient from getting on dialysis. And that's our job as primary providers. We're trying to do no harm. We're trying to help our patients. So ultimately, that urine protein is something great that can help you. The last thing I want to say, the last slide, proteinuria is any amount of protein in the urine greater than 250 milligrams per day. If you see that, you need to start a workup for proteinuria, but also consider referring to nephrology or referring to endocrinology if it's diabetes causing that proteinuria, or if it's albuminuria. Incidentally, we take the spot urine albumin divided by the spot urine creatinine, and we get how much albumin they're spilling in a 24-hour urine. The first indicator that somebody has kidney disease is proteinuria. That's how we know something's happening at the level of the glomeruli. Those basement membranes in those glomeruli are losing protein. Those foot processes inside that glomeruli are not doing what they're supposed to do. So they're losing albumin in the urine. Remember, the serum albumin starts to drop when patients have proteinuria, and that albumin is in the urine in a lot of cases. So what you need to do as a primary doctor, your call to action is check your urinalysis. That's great. It tells you blood, nitrite positive, which indicates infection, and also 1 plus protein, 2 plus protein. That's only a qualitative measure of how much protein the patient has. But we want to know quantitatively how much, the exact amount. That's where the urine protein to creatinine ratio comes in. So if you check that urine protein, divided by that urine creatinine on a spot urine sample, that will give you a quantitative amount of protein. And that has diagnostic and prognostic value. So start ordering those on your patients to get a better handle of how much protein they're spilling, and to get a better handle on who needs nephrology referral or who just needs more aggressive blood pressure reduction, more optimization of their diabetes. So this is our proteinuria kind of talk. I hope it was enlightening. We have a free webinar below. Click on the link below. We have a course that talks about all of this in more detail than this little snippet. I hope you click link. You know what to do. Subscribe. You know how we do it. But at the end of the day, I hope I see you in our class, because we will dive into all the things that you see in primary care, and you will basically kind of be like a baby nephrologist. Our classes are designed with clinical management in mind. So there are quizzes after each module. There are 7 modules. So check it out. Tell us what you think on the webinar, and hope it's helpful. I hope this video was helpful. Thank you. Goodbye. See you in the next video.